Hi everyone, my name is Aarathi. I am the founder at Pause for Perspective. I am also a psychotherapist myself. Today I wanted to talk about what trauma informed care looks like and what to expect from your psychotherapist or counselor who is trauma informed. Now, in order to understand just what trauma is, the historical understanding within the side disciplines around trauma, and to understand what are the symptoms of PTSD, but also what the symptoms of CPTSD are, which is complex trauma. I'm going to invite you to go on to our YouTube channel where we're actually currently doing a series on looking at these aspects. It's a teaching series, so there are several videos that have been being recorded to help you understand these aspects of trauma itself. Today, I wanted to talk about just that piece where I wanted to sort of introduce what to expect. Okay, so you know all of these things about trauma, but what can you expect from working with a psychotherapist? Is what I wanted to talk about. So one of the first things is that you don't ever have to go into your trauma, or even, in fact, you should never be reliving your trauma. But you don't have to ever go into your trauma without your and the narrative of trauma without your explicit consent, as well as your affirmed assent, and with full awareness of where this might be going when you do explore memories, for instance. Now, oftentimes there is this sort of perhaps belief or understanding within the field and even outside the field that, just people who do experience trauma, that if I come and speak about what is going on, then it'll go away. But that is not the way to hold experiences of trauma. We want to be able to make space for it. We want to be able to ensure there is safety within the conversation, because most of the times when we are unpacking difficult things, it's hard to close it at the end of an hour and go back into the world as if everything is okay. So there are times when you are going to feel very raw at the end of sessions, and then there needs to be ways in which your therapist talks to you that allow you to know that this unpacking can do this, but also that there are ways in which you can ground yourself and you can work with any dysregulation, discomfort that might open up, right? So part of an informed trauma-informed therapist is that they will work with you on helping you understand the ways in which we might move into conversations about trauma. And of course, like I said, there has to be informed consent, there has to be affirmed assent. You need to understand what it is that you will be doing with the unpacking that will happen. You need to understand how the unpacking will happen. You want to understand that there is a way to do this that where there is safety restored again, and that you're not going back feeling extremely triggered. Yes, there will be times when you go out after a session feeling extremely triggered, but then have you and your therapist spoken about how to sort of contain it, hold space for it, so that you can come back and continue to work on what is going on. So the first point that I said is then that you don't ever have to go into your trauma or even just relive it without your explicit awareness, consent, and affirmed assent. Now, processing trauma is different from reliving trauma. So there is that important piece as well that your therapist will talk to you about to ensure that there is a way in which you're sort of moving into this, into difficult terrain. Right. So that's the first point. The second one is that your therapist will ensure you feel safe to begin and safe to leave the space. Now, like I said, all encounters, therapy encounters are very vulnerable ones, and then you want to, of course, be someone who feels held. So your therapist will talk to you about safety, right? Like, if you're feeling there are ways in which the therapist will ensure that there is safety to begin a conversation, but also at the end of the session that there is a check-in about, we will be leaving in this way. How do you feel? If there is any sense of overwhelm, how might you be able to will you be able to deal with it? So those conversations need to happen as well. Now the third piece is that your therapist will help you understand that a lot of unexpected thoughts and feelings may open up between sessions. So I often do this when I'm doing work with people who come in with trauma. I will let them know that a lot might open up between sessions, and I will work with them on seeing if there are ways in which they can reach out to me or they can reach out to emergency services when and if things do go wrong, or just things become difficult, right? So it's important that your therapist works with you on helping you understand that therapy is a difficult process, but it is a process where you are unpacking and healing, and that healing is not a linear journey, nor is it a smooth one. There is a lot of pain in healing, and that will happen, and your therapist will work with you on making space for that with you, right? Now the fifth point, the last piece that I want to be able to talk about, is that your therapist will help you see that we respond to trauma the best way we can, and that trauma is not your fault. Now this is one of the biggest pieces, right? Like with trauma, often there is that sort of conflation with shame itself, and oftentimes a trauma-informed therapist will ensure that they're constantly letting you know that in no way the trauma is your fault, and that you have responded in the best way your nervous system knew how at the time that you were in the space of trauma. So there'll be a lot of unpacking of that as well in your sessions. Now those are the five sort of really brief points around trauma that I wanted to share with you. There are, of course, this is not an exhaustive list, but you do want to, as a consumer of mental health service, as someone who is within the field as well, you want to be able to know that these are some of the sort of basic aspects that you want to include in the work of trauma-informed care. If you have any questions, you have any thoughts, any pieces that you would like to add to, feel free to email me, and I'll be happy to strike up a conversation with you. Thank you so much for listening. Bye-bye.